All right, I don't see anyone logged in just yet, so.
No, it won't show it until we go live.
Oh, okay, I'm sorry, I thought you did.
Hey, Michaela. Nice to see you.
You too. How are you?
I'm doing well. I hope you are. And
I am. Thank you.
we're coming back.
No problem. I was just saying we love partners, so I'm happy to do this.
Thanks.
Hey, everybody. I'm going to hit go live.
All righty. So good afternoon, everyone, and welcome to Partners Member Cafe. So glad you're here to join us today. I see our numbers ticking up, so we'll wait just a few moments to get started so everyone gets logged in. All right, so let's go ahead and get started. My name is Ann Gloff. I am part of the member engagement team here at Partners Health Management. Again, welcome to Partners Member Cafe. So we also have a few other members of our member engagement team here with us today, and that is Beth Brooks. She is manning the Zoom and making sure everything is running nice and smoothly. We have our guest speaker, Michaela. I'll tell you a little bit more about her in a minute. Melissa Hatton, also part of our member engagement team. Melissa, you want to give a wave? Melissa's going to enter some great information in the chat for you, so you can just do a quick copy and paste. And then Allison Crotty, Director of Member Engagement, is here with us today too. So glad she's here to join us. So just a little bit of housekeeping before we get started with our guest speaker. Today we're offering our session in closed captioning, and you probably see a little link on your screen that says closed captioning. If you don't need to see that, you simply just need to hover over the live transcript and click on hide subtitles, and that'll disappear for you. So just for those of you who are new to Partners, if you're not familiar with Partners, we are a managed care organization for North Carolina Medicaid and other state funded services for mental health, substance use disorder, intellectual and developmental disabilities, and TBI. So at the end of our session today, after our guest speaker, I'll share a little bit more information with you as time permits. So housekeeping, just want to remind you, our session is being recorded, so be careful and don't share any too much private healthcare information. We certainly, if you have something you want to discuss, we can set up some time to talk with you after, or set up another time. What else do I need to tell you? If you have questions. So if you have questions during our session, feel free to enter them into the Q&A. So if you look at your screen, you'll see two little bubbles at the bottom, and underneath it says Q&A. So need you to enter them there. The chat feature is actually disabled for you all to enter any information. So any questions are going to go into Q&A. All right, Beth, you want to pop up that slide so I can introduce our guest speaker? So I want to give a really nice warm welcome to Michaela. Michaela Cardona is part of NAMI, National Alliance on Mental Illness for North Carolina. And she is going to share with you all about Nami. So Michaela is an affiliate and an outreach specialist for Nami. She received her degree from the University of Wisconsin before moving to North Carolina. And Michaela lives in Raleigh and works to support 24 Nami affiliates around North Carolina to provide free support and educational programs for those affected by mental illness. So I am going to let Michaela take it from here. If you give her just a moment, she's going to share her screen and share information. And again, don't forget, anytime those questions pop up, just drop them into the Q&A and we will stop and moderate and have your questions answered. So take it away, Michaela.
So thank you so much, Anne. I am happy to be here. I am here to talk to you today about Nami, North Carolina. And if you have not heard of us before, don't worry, I will go over everything that we do and everything that is available to you in North Carolina. So first things first, my name is Michaela Cardona, and as Anne mentioned, I work for Nami, North Carolina. I put my email there. It's mcardona@naminc.org. If you have any questions about anything that I go over today or want to get more involved with anything that we offer today, please do not hesitate to reach out to me. If I don't know the answer, I can definitely connect you to someone on our team that does. And I am usually very quick to reply on email. So email is the best way to get a hold of me. So I'm here to talk to you about NAMI. So first, let's go ahead and just define what that is. NAMI stands for the National Alliance on Mental Illness, and we are the largest grassroots nonprofit organization dedicated to building better lives for the millions of Americans affected by mental illness. So NAMI is actually a 3-level organization. We have NAMI National, which is located in Arlington, Virginia. Each state, all 50 states within the United States, have their own state office. So here we have NAMI North Carolina, that's where I work. And then we have local affiliates all throughout the state. So here is a map of where our local affiliates in North Carolina are located. Please note that this is not the most up-to-date map that we have. We have added a few more affiliates over the past few years, and we are working on updating our map. But this in general is the areas of where the affiliates are located. If you are, oh gosh, sorry, my dog's barking. Sorry, 1 second.
Yeah, no worries, Michaela. In the world of Zoom, I am sure that all of us have heard dogs barking, children laughing, all of those kinds of things. So
Yes, thank you for bearing with me. I'm sure it was an evil mailman out there that he is protecting us from. So back to NAMI North Carolina. So you might be wondering what our local affiliates actually do. And in a nutshell, they provide support, education, and advocacy, and public awareness so that all affected by mental illness can build better lives. So the main way that our affiliates do this is by actually offering NAMI's signature programs to our communities. Everything that we offer is completely free, completely confidential. And the unique thing about NAMI is that all of our programs and support groups actually follow 2 paths. We have peer-led support groups, and we have support groups for loved ones and family members. So our peer-led support groups are for those who have a mental health condition themselves, and our loved one support groups and programs are for the loved ones or family members of someone who has a loved one or family member that has a mental health condition. Here at NAMI, we really understand that when someone is dealing with a mental health condition, it doesn't only affect them, right? It affects their mom, their cousin, their brother, their grandmother, every single person that cares about them. So at NAMI, we really want to make sure that we are offering support and education to everyone that's affected by mental illness. The other really unique thing about NAMI is that all of our programs and groups are actually led by trained volunteers with lived experience. So that means if you are in a peer group, your facilitator is going to be a peer themselves. If you are in a family support group, your facilitator is also going to be a family member with someone with a mental health condition. So we really create this very comfortable, safe environment that allows you to ask all the questions that you have and really get the support that you need. We try to get rid of that patient-doctor gap and make sure everyone is on the same playing field and create a really safe and warm environment. Some of the peer programs that we have, number one is our NAMI Connection Support Group. This is a free peer-led support group for any adult who has experienced symptoms of a mental health condition. Our support groups are a group that you can come to when you feel like you need it. There's no commitment. You do not have to put on your schedule every single support group. It's there when you need it. And if you don't feel like you need it that week, you don't have to show up. There's no commitment. We also have what's called NAMI Peer-to-Peer. This is a very popular program for 8 straight weeks for adults with mental health conditions who are looking to better understand themselves and their recovery. This is a really, really great program for you to really have gained some coping mechanisms, for you to understand your diagnosis a little bit more, and for you to just find the support and kind of group that you need. For our family and loved one programs, we also have a support group. So this is called NAMI Family Support Group. Although you don't have to technically be a family member, you could be a friend, just a loved one of someone who is experiencing symptoms of a mental health condition. We also have 2 programs that are available. Number one is called NAMI Family to Family, and this is a free 8-session educational program for families, significant others, and friends of people with a mental health condition. This is absolutely our most popular class. It's evidence-based, and it really helps you be able to learn how to support your loved one, but also for you to be able to support yourself. Because here at NAMI, and that you cannot pour from an empty cup. In order for you to help your loved one find that path of recovery, you also have to take care of yourself. Nami Basics is also a free program that we offer. This is very similar to NAMI Family to Family, but is more structured for the parents and caregivers of someone who has a young person, which we define as ages 22 or younger, who are experiencing mental health symptoms. With all of our programs and groups that we offer, we have no requirements or have any surveys or anything that you need to fill out in order to attend. If you feel like you could benefit from our programs or support groups, you are absolutely welcome. Finally, we do have a few presentations that are available, excuse me, that you can bring to your office, to your school, to an event, to your company, to put on for your employees. Basically, wherever there's people, we can bring this presentation to you either virtually or in person. The first one is called NAMI in Our Own Voice. And this is a presentation that is from the perspective of someone with a mental health condition that has found recovery. And it really aims to change attitudes, assumptions, and ideas about people with mental health conditions. I have a little video that I'm going to share in the next slide about this presentation, but it's very, very powerful. And it's really moving to hear the perspectives of someone with a mental health condition and share their journey. The next presentation that we offer is called NAMI Ending the Silence. Again, this is from the perspective of someone with a mental health condition themselves who have found recovery. And this is designed for middle and high school students, but it also includes warning signs, facts, and statistics about mental illness and how to get help for themselves or a friend. So this is a very empowering presentation. The speaker is usually under the age of 35 so that middle school and high school students can relate to their story a little bit more. And it's very, very beneficial to bring into schools. The last presentation we have is called NAMI Family and Friends. And this presentation is from the perspective of loved ones and family members. And it lets people know how they can support their loved one and again themselves through this journey of recovery. So as I mentioned, I do have just a quick 1.5-minute video about NAMI in Our Own Voice. If one of you could give me a thumbs up to make sure the sound is working, and then I'll let it play.
The incidence of mental illness in our society is almost 1 in 5, to some say even 1 in 4.
People are being diagnosed with mental health conditions more and more every day.
It can be your family member, your friend, your neighbor, and even your physician.
It doesn't define who they are, it's just one part of them.
A lot of people who have some sort of mental illness, they're afraid to come out and talk about it.
And that's the whole point of me being here, is to just let people know that you can have a mental illness and you can still have a happy, successful life.
So today we were out working on the new video for Nami's In Our Own Voice presentation.
In Our Own Voice presentation is a program through National Alliance on Mental Illness where we go out and we go to various venues and we share our story about what life is like living with a mental health condition.
I think In Our Own Voice is something really important to have in any institution.
Whether you're at a school or a correctional facility or, an office.
Of all the programs that I'm trained in with NAMI, I think that this one for me is the most meaningful because it gets me out into the community. It gives me an opportunity to talk to folks about mental illness, to kind of shed a light on what it is and what it isn't.
I think it's important to have conversations and break down stigma because of the fact that it's so prevalent.
We see images of mental illness in the media that don't really portray the whole story.
It's important that people know that there's a place to go to where they can get information and get help.
It's not all dark days. There's a lot of light that can come out of your situation.
By sharing our stories with each other, we helped each other a lot today. I felt like I was not alone.
To find out more about this free presentation, go to nami.org/IOOV.
So as I mentioned, that is a very, very powerful presentation. It's definitely one of our most popular ones. It can be adapted to work for the audience that you have. So if you have kind of a certain generation, we can adapt it to that. If you have just employees with a wide variety of ages and demographics, we can adapt it to that. And everything, as I mentioned, is completely free. So if you do want to set up one of those presentations, feel free to contact us and we will work with you to set that up. So I know I just dumped a lot of information about all of our programs, but if you want to read more about them, you can go to our website at naminc.org and hit the programs tab there that's circled in red. If you are interested in joining one of our programs virtually, that is the same location that you will go to, naminc.org, hit the programs tab, and there'll be an option for you to select virtual NAMI programs. There you will see the complete master list of all the programs that are being held virtually all over North Carolina. You do not have to be within a certain location to join a group. All you have to do is register and you will be sent the link to join that virtual group. Again, we don't ask any requirements. We don't ask any certain diagnosis. If you feel like you need that program, all you got to do is register. You don't even have to turn your camera on if you don't want to, and you can get the support that you need. Finally, one of the last resources that we offer is our helpline. Our helpline is open 8:30 a.m. to 5 o'clock p.m. Monday through Friday. You can call, email, or text the helpline with any mental health questions that you have, any questions about our programs. If you have questions about housing, about insurance, about employment, anything mental health related, we can try to help you with it. If we don't have the answer, we can refer you to someone that may have the answer and can help you. So if you have any mental health questions, do not hesitate to reach out. Again, this resource is free, it's confidential. You don't even have to tell the people who you are. Our helpline team is absolutely amazing, and they will be able to work with you and talk with you through any questions that you do have. Finally, the last slide I want to share is just a little plug for our NAMI Walks event that is coming up, not this Saturday, but next Saturday, called NAMI Walks North Carolina. This is our biggest fundraiser and mental health awareness event of the year. This is what allows us to keep our programs free throughout the entire year, our helpline free throughout the entire year. Also just a really big day of celebration to come together and see how far we've come over the last year, to celebrate all the programs that we've offered, and just to come together and celebrate that we've made it through these last few more than difficult years. This is going to be our first walk in person in 3 years. So we're super excited to actually physically get together. Everything will be outdoors. We're hoping for some good weather, but we do would love for you to join us. You can register at namiwalks.org/North Carolina or go to our website, naminc.involved. And with that, I'm going to share my screen, open up for questions, and thank everyone for bearing with me with my loud dog in the background.
All right, so this is your time for questions. So does anyone have any questions for Michaela about NAMI, about mental health in general? This is your time, so feel free to pop anything into the Q&A, or if you want to talk, we can unmute you.
We do have someone who has said, "Thank you, Michaela, great information."
And I will say, if anyone in the audience is interested in becoming a leader of any of our NAMI programs or becoming a presenter, if you feel like you have a great story that you'd like to share, we would absolutely love to work with you. We provide the training, everything is free, and you work with your local affiliate to get the training done. Again, just shoot me an email and we can make that work.
We do have a question. Do you have a support group for specific mental health disorders, such as a support for bipolar or borderline personality disorder?
So at this time, we do not. It is up to our affiliates to structure how they want to set up their support groups. We do have support groups that are specific to parents or to friends, but we don't have any support groups currently that are specific to diagnoses. But I would say our NAMI Connection support group would definitely be relevant to bipolar disorder or any diagnosis really. You will be able to find people in that group who you do connect with and do kind of share similar stories with. So I would just try our NAMI Connection support group. You can do it virtually, finding a support group on our website. And I think you'll definitely get the support that you're looking for through that.
So I have a question for you, Michaela. You had mentioned that you do the presentations for any audience that's interested, if it's a work environment, if it's a school, whatever. Do you ever do presentations for families? I know of families that it's adult siblings and maybe one of the siblings has a mental health disorder and they've never quite understood it. So is that something that the affiliates might do?
Yes, absolutely. And for family members, I would recommend that NAMI Family and Friends presentation. Really what that presentation is our NAMI Family to Family, that 8-week course, boiled down into a 60-minute presentation. So you kind of get a thumbnail version of our Family to Family class, which teaches you kind of how to understand your loved one with a mental health condition, how to support them. It does a lot of problem solving skills. It also teaches people to take the guilt off of themselves and kind of learn that you have this community that are in the same boat as you with other family members. That NAMI Family and Friends presentation can be done for any size audience. I think we've done some to as little as 3 or 4 people, and it's still very interactive and beneficial. So that is absolutely a possibility. We can also have that presentation up to hundreds of people, but really the audience size, we can adapt to whatever works best for whoever we're presenting to.
Great, thank you.
Next question is, how does your organization help families with preschoolers? Are there mental health issues for young children that NAMI assists with? I know that finding mental health care for children under age 4 is very difficult.
Yes, that is a great question. So all of our programs and our support groups are for adults, meaning 18 years and older. But I would suggest that Nami Basics class, which is for the caregivers and the parents, that class can actually be adapted to teachers as well. so that teachers who are working with preschoolers or the parents who have preschoolers, I think would find a lot of beneficial information within that Nami Basics class. The unique thing about Nami Basics as well is if an affiliate is not currently offering that class, we do have an online on-demand option for Nami Basics. So you can take it on your own time whenever you can online. You can pause whenever you need to. You can come back to it. And you can be able to kind of get that information that you need to support those preschoolers.
All right, so great information. Any more questions for Michaela or about NAMI? Okay. All right, so what I'd like to do right now is share a little bit information about partners in general and tell you about our member engagement team and how we support our members and individuals in the community. All right, so Partners Health Management. I mentioned just briefly as we were beginning, if you weren't familiar, that Partners is a managed care organization. And we manage Medicaid and state-funded dollars for behavioral health services. And what behavioral health means is mental health, substance use disorder, intellectual and developmental disabilities, and traumatic brain injury. So Partners is kind of similar to an insurance plan, a health plan per se. So we are very proud to say that we are a member care organization. So as a member care organization, what we do is we don't provide direct services, but we ensure that there is a network of providers that can provide the support services needed for behavioral health, that's substance use, mental health, developmental disabilities, traumatic brain injury. So we provide advocacy, support, and education for our members and families as well. And that's our focus across the company, but really our strong focus in member engagement. We have a crisis call center. Our Partners Access Center is, you can access them 24 hours a day, 7 days a week, and the number is right there on the screen. And Melissa's also popping that information into the chat, so you can grab it and cut and paste really simply. So there you can see that number, 888-235-HOPE or 888-235-4673. So Partners serves 14 counties. You can see them there listed on your screen. So we are one managed care organization across the state. There are 6 managed care organizations. They are all covered. All 100 counties are covered by a managed care organization, and they are very similar to Partners. So member engagement, I mentioned earlier, that's who we are. We host the Member Café every month for you to provide education and information. So we're here. We have a customer support line that you can call into. Perhaps you have some questions about services, about your family, about a family member or a friend. You're not really sure which way to go. So we're here for you. We're here to help you navigate our behavioral health care system, maybe to identify resources in your community that you might not be aware of. It could be a local agency that provides a support group. There's a group that's across North Carolina called the Family Support Network. That's just an example of one agency we might share with you. We also provide education in the community, doing education presentations, kind of similar to what Michaela did about NAMI. So we do education presentations about IDD services or mental health. My apologies. So today we have barking dogs and we have phones that are ringing. So is my voice back up, Beth? I know sometime, okay, yep. Anytime a loud sound comes up at my computer, my microphone goes down. Can y'all hear me now? Let me see what I can do. How about now? Excellent. Sorry about that little interruption. So again, that's what we do in member engagement, is we can help you with that. So Beth, if you want to flip to the next slide, that'll show our phone number there. So anytime you want to connect with us, you can call that number right in the center of your screen, 704-884-2729. And let me tell you how that works. We have a group of member engagement specialists. There are 6 specialists, as well as Beth and I as supervisors. And so our goal is always to answer that call line live. If we are not able to answer live, if everyone is busy, it does roll from one specialist to the next. It will go to voicemail, and we make it our goal to answer your call and call you back within 24 hours. You can also send an email to us if you prefer to communicate by email. Just send it to memberquestions@partnersbhm.org. There's a little blip on there about Member Connect as well, and I'm going to share more information with you about that in just a moment. But before I do that, let's talk about the Pix Health Mobile App. I don't know if you've heard of the Pix Health Mobile App, but this is an app that is available to all of our members, and it can help you monitor physical and mental health. So you can register for this app and get it loaded onto your phone by calling the number on your screen right there, 855-499-477, or going to the link, the site right there, www.hipix.com, and you can simply download the app to your phone. Once you get on the app, you are able to interact with just this great little chat bot. He's right here on your screen. His name is Pixar. You can talk with Pixar. You can access resources. You can access assessments that are going to help you identify kind of maybe where you are. It really focuses on your daily mood. It gauges loneliness. And we also have connected with this mobile app a compassionate call center. All of the folks on the call center are peers. So they are individuals who have experienced mental health themselves. They have lived experience. So that is available as well. So it's a great app. So I really encourage you to check it out. So let's now talk about Member Connect. So if you are a member here at Partners Health Management, or you're a recipient of state funds, you can log in and create an account, a login for Member Connect. And what it enables you to do is take a look at your own health record. For example, if you are, maybe you have a family member who has an intellectual disability and they receive innovations waiver services, you can go in here and look at documents such as their annual treatment plan. You also will find quick links on the Member Connect site that is going to help you get to information about benefits, going to help you get quickly to our member handbook, or maybe take a look at your rights and responsibilities. You also can quickly access health screenings here from Member Connect. So you go to the Partners website, and up in that right hand corner, you can see where it's circled in red. You click on Member Connect. And if you're not already logged in and have a login, you just set that up, and then you will have access from that point forward. So Member Connect, a great way for our members and recipients to stay connected. Also in Member Connect, you can message us. So you can send an email to Partners. These emails are monitored on a daily basis for our member portal, and it will get you'll get a quick response letting you know that we've received your message, and then you'll get connected to who you need to get connected to answer your questions. So a great way to stay connected is Member Connect. So you might want to know, who do you call if you have questions about partners, maybe questions about something that's going on with a provider, just questions in general. So if you're receiving services, your first connection is your provider. They're also your first responder in a crisis. So then, of course, you can also call the Partners Access Center at that 1-888-235-HOPE or 4673 at 24 hours a day, 7 days a week. And then, of course, if you have a care manager assigned to you, you're going to want to connect with your care manager. And if you're not receiving services and you have general questions, just as I mentioned before, you can reach out to us in member engagement. And there's that phone number for you again, 704-884-2729. Or you can email us, memberquestions@partnersbhm.org. We're always happy to help you in any way that we can. So next, I want to tell you about Cfac. You may or may not have heard of Cfac. Cfac stands for Consumer and Family Advisory Committee. So the Cfac's made up of a group of volunteers. They are members or family members, and they represent those who receive services for mental health, substance use, traumatic brain injury, intellectual and developmental disabilities. And so they are advocates on behalf of all individuals in our public behavioral health system. So Cfac is looking for members. So if you're interested, right there in the center of your screen, you can see the Cfac email address, cfac@partnersbhm.org. If you want to find out more information, there's a link for you there that's going to take you right to the site on our website where you can read more about the Cfac. And I know that Melissa has also dropped that into the chat for quick access. All right, so what else can I share with you? Let's see. All right, so stay in touch with us. It's a great idea to stay in touch with us and keep your contact information up to date. I know sometimes we move, maybe we change phone numbers, and so super important to keep your behavioral health plan up to date, whether it's Partners or another one. We may want to reach out to you and share important information. And even more important, if you receive Medicaid and you do move, maybe you change your phone number, you really want to connect to your Department of Social Services to update your information. They are the main keeper of contact information for Medicaid, and it's super important that they have your right phone number and your right email. So you're going to want to reach out to them directly in your county to update that information. So if you receive state funds to update your information, you're going to call us here at Partners, and you can do that by calling the 888-235-HOPE line and just let the Partners Access staff know that that's what you're calling for, and they will support you in making those changes. All right, so that's all I have to share with you about Partners, member engagement, and all the ways that you can communicate with us. So if you have any questions, I'm not sure what our time is at. We still have more time. We have plenty of time for questions. So now's your chance to ask any questions about Partners, about NAMI and the services that they provide. So what can we answer for you?
Anything in the Q&A at this time, but please go ahead and put your questions in or comments.
All right, so everybody's quiet today. This is a great time for you to ask a question or really just share a comment if you want us to take something back to Partners. You know, that's another role of member engagement, is we're here to take the member voice, your voice, inside of Partners, because, you know, sometimes we only know what we know, right? So if you all in our community are share with us what's going on, we can take it back to the right people inside of Partners to support you, to maybe make a change with something, or just, to let us know so that we know what the needs are in the community. All right, Beth, all is quiet. So I want to give a great big thank you to Michaela for joining us from NAMI today. Great information. We do partner with NAMI, and we are so excited that Michaela is here with us and sharing more information about the programs that they offer. And then just to let you know, next month for Member Café, next month, June is Pride Month. So we'll be focusing on the LGBT community. And we have a guest speaker from PFLAG. I don't know if you're familiar with PFLAG, but it is a support group, an advocacy agency for families and individuals in the LGBT community. And so we have someone that's going to come and share some information. So we're excited about that. Beth, do I see something in the Q&A that popped up?
You do. It says good, useful information. Thank you. And then maybe a little on new changes in December. And Allison, we aren't able to really go in deep till a certain point. Is that correct?
Yeah, we can give general information about Medicaid transformation to North Carolina managed care, the second phase of it that starts December 1st. I'm happy to answer some general questions about that. We and the state will be providing community trainings on that in a few months. So first, there'll be marketing about the plans that's coming up in August. And the state will be mailing out some information to members and families about their choice. And then in October, there'll be a lot of robust trainings in the community, but you'll see those before that as well. And there's a lot of information that's being shared by the Ombudsman Office. So it's the North Carolina Ombudsman for Medicaid. And even state-funded folks can call them for general questions, for advocacy. They're doing a series of webinars that gives updates about how North Carolina managed care is going. So that's a great place. And the enrollment brokers website, the beneficiary site on the North Carolina Department of Health and Human Services site. We can put that in the chat, those links. But if you all just want to get more information about it, please call us and we can talk to you about it as much as you want. Or if you have some questions right now, we're happy to answer those.
So the next question is, will there be care coordination for mental health?
Yes, there will be care management for mental health, and it'll be different depending on the type of needs that a member has. The only difference, so every Medicaid or Health Choice member will have the option to have tailored care management. State-funded members who utilize state funds or who are uninsured or underinsured, they will likely, if they meet certain criteria, also get care management, but not everyone will get automatically care management like they will if they have Medicaid or NC Health Choice Medicaid. Does that answer your question? Was it Mary? So the biggest difference with care management that's called tailored care management will be starting December 1st is that some of the care management will be managed in the community and not by the tailored plan, which we will become on December 1st. All the LME-MCOs will become tailored plans and will manage different contracts, the tailored plan, and also still Medicaid Direct for some populations. And we won't manage their health care. So, and then there'll be agencies in the community, care management entities that will be providing care management as well. Care management will also be provided by advanced medical homes. And there's a whole big white paper on the care management. I think there's a whole website on DHH's website, information about care management and all that will entail. And it'll be much more robust and, more contacts face-to-face and electronically or by phone with members. It's going to be a lot more intensive than what is happening now.
And there's a follow-up comment that, yes, thanks. Great program today.
Thanks, Mary. Great question.
All right. So anything else before we wrap up today? All right. Thanks so much for joining us today. Oh, I see a finger
I see
up.
something came in. We have met Latasha, Mary Beth, and Jackie here. Great.
Okay. And for Scythe, we have met Latasha, Mary Beth, and Jackie. They are great. And that's
good. Well, you'll see the community engagement staff like Jackie and who else did you say? Mary Beth. And Latasha's with member engagement. We're the engagement piece, portion of partners, and we work together to really stay in touch with the needs of everybody and provide information, trainings, and navigation. So we are working on putting together a grid of who to call in what region. And we think that'll be helpful to families to know who to call to help or how to refer people. But thank you for that shout out.
We have another question. There's some older people who don't understand. Are you willing to come out and explain to like a church event? And so maybe clarification on NAMI or partners or both?
Yes, certainly. Yeah, we would be happy to do that. We could also partner with the gas team to do that. The geriatric, oh boy, alphabet soup. What is it? Geriatric, who can help me? It's a program that we have of partners that's in certain counties, and they do a lot of education and training on behavioral health to agencies who serve older adults. And we call them the gas team, and obviously don't know what it stands for. So
I just looked it up, Allison. It stands for Geriatric and Adult Specialty Team.
There you go. That'll get me for using the acronyms, but we could certainly do those trainings. I think we prefer to go where people are in their environments to help them understand the system more. That makes much more sense than inviting them to a Zoom meeting all the time. But we want to have different options for everybody. So
yeah, if you just want to reach out to the member engagement team, you can do that by calling the number 704-884-2729 or send an email to memberquestions@partnersbhm.org with that request. If you have something in mind and a location for older adults, then just let us know and we'll work together with you.
Kayla, would NAMI be able to go to a church, do a presentation?
Yes, absolutely. We can put a presentation for your church. We've also had situations where support groups and programs are actually held at churches. So we really like to have good relationships with churches, and we would be more than happy to go to where you all are. Yes.
Great. All right. I think we're right about at time. So again, thanks for joining us today. It was a great session, great questions. And we hope to see you next month in June for our LGBTQ topic. And thanks again for spending your time with us today. Y'all have a great afternoon. Bye-bye.